and welcome back to the Medigap Show. I'm your host, Holly Cohen, licensed agent and founder of MedigapCares.org. We are a nationwide health insurance agency specializing only in Medicare. In this episode, we're covering the J.D. Power 2023 Medicare Advantage study. To make sure that you never miss such insightful content, I encourage you to subscribe and activate the notifications bell. I put out these shows to educate those new to Medicare, or even if you have been on it for a while, so that you will gain a clear understanding that there are two completely different ways to be on Medicare. One way is having your original Medicare, which pays 80% of your medical bills for anything that your doctor deems as medically necessary for you. This way allows you the freedom to go to any doctor and any hospital in the entire United States who will accept your red, white, and blue Medicare card. Most people that go that route and stay with original Medicare also have a Medigap, also known as a Medicare supplement plan, defined by a letter, either an F, a G, or an N. So this was the original way Medicare was intended when it first came out in the mid-1960s. The other way to be on Medicare actually takes you off of the federal or original Medicare system and fund and puts you on a Medicare Advantage plan. The Medicare Advantage plans are the privatization of Medicare because it is an insurance company replacing your red, white, and blue Medicare card. And then the insurance company takes over completely and manages your health care. You still do pay the Part B premium of Medicare, which for most Americans this year in 2023 is $164.90. However, your health care is no longer run by our federal original Medicare system. If you're on Medicare Advantage, it is completely managed by the insurance company. And then you also will have the provider networks, and you must make sure your providers are in their networks. Even on the PPO Advantage plans, providers are not obligated to see you outside of your network, including the major cancer hospitals around the country. These Medicare Advantage plans typically have zero monthly premiums, but there are restrictions. You must stay in the network for the full benefits. You are off of the federal Medicare system. In fact, the government pays the Medicare Advantage insurance company approximately $12,000 per year just to take you off of our Medicare fund, our original Medicare, and then transfers your health care to be managed and approved by a publicly traded insurance carrier who can even deny coverage with prior authorizations. There's also a max out of pocket on these plans. So free is not always free. So now let's take a look at the J.D. Power study and see how satisfied members on Medicare Advantage plans really are. You will find the results to be very interesting. For Medicare Advantage plans, trust and problem resolution closely associated with likelihood to renew, J.D. Power finds. For Medicare Advantage plans, trust and problem resolution are closely associated with the likelihood to renew, J.D. Power finds. As the number of Medicare Advantage plan options continues to grow, competition for new members and retention are becoming increasingly critical, says Christopher Liss, Managing Director, Global Healthcare Intelligence at J.D. Power. Additionally, in 2023, member experience and satisfaction are prominent drivers of CMS, that's Medicare, their star ratings. Complementing these trends, J.D. Power research demonstrates that consumers are becoming more sophisticated about researching their healthcare options. Consumer-facing brand attributes like trust, reputation, reviews, and customer ratings have become key drivers of satisfaction and customer loyalty. Most Medicare Advantage plans are performing well on the basics. Yet, as a side note, that's of course if you don't intend to really use the Medicare Advantage plan if you have a serious health issue. Yet there are opportunities for improvement in the areas of ease of finding care, care coordination, and innovation around the digital self-service. Plans perform highest on trust, ease of doing business, and meeting member product coverage needs. Trust and problem resolution hold keys to customer loyalty. Level of trust and resolving problems or complaints are the most highly correlated factors associated with members renewing their health plan. Just 31% of Medicare Advantage plan members say their plan made it easy for them to find care, and just 34% say they used two or more of the digital tools offered by their plan. And then you can look at this article, and I'll provide the link in the description below. It actually lists the different carriers and how they ranked. The U.S. Medicare Advantage study was redesigned for 2023. The 2023 U.S. Medicare Advantage study is based on the responses of 5,887 members of Medicare Advantage plans in 5 market-based U.S. regions. Those include California, Florida, New York, Pennsylvania, and Texas. It was fielded from January through June of 2023. Let's look at another article still discussing the same J.D. Power study, and this was from MedCity News. Medicare Advantage plans particularly do well based on trust, ease of doing business, and their product coverage offerings. Members are most likely to renew their health plan if they trust their plan and if their plan is good at resolving problems or complaints, the survey discovered as well. In addition, J.D. Power found areas where Medicare Advantage plans are lacking. As I just discussed, only 31% of the respondents said that it was easy to find care, and just 34% said that they used two or more digital tools provided by their plan. Most Medicare Advantage plans are performing well on the basics, yet there are opportunities for improvement in the areas of ease of finding care, care coordination, and innovation around digital self-service, said Christopher Liss, Managing Director of Global Healthcare Intelligence at J.D. Power in a statement. So my curiosity is, of this study, what were the health conditions of those 5,000 people that they studied for J.D. Power and Associates? But again, consumers are becoming more sophisticated in researching their healthcare options. They're starting to learn that Medicare Advantage is not the only option. As a licensed agent, when I first got into the Medicare space, I thought that there was only Medicare Advantage. I didn't even know we had original Medicare and that was an option because of all the commercials that just have always been around for the last even 10, 15 years. They just have become, these commercials have become much more pronounced over the last 3 years. And then this year in 2023, the current administration in Washington has decided to clamp down on Medicare advertising, making it much more difficult to, and I hope this is what we see in this next open enrollment starting on October 15th, but that we're not going to be slammed with the misleading Medicare commercials. Those commercials are not at all about Original Medicare and a Medigap plan. Those television commercials are only about Medicare Advantage. So please, once again, as I urge everyone every single year, do not call that phone number on your screen. If you're on Original Medicare, that agent on the other line will take you off Original Medicare. They are just call center agents. They are relying on bonuses and spiffs and lots of hype to write their next policy, and they could care less about the person that they are speaking to and that person's health condition. And I have heard so many horror stories about these call center agents that don't even ask what doctors that the Medicare beneficiary sees. I just had a call today, as a matter of fact, for a new client of ours who has a kidney issue and started a Medicare Advantage plan, an HMO, where she would have needed a referral to see a specialist. And she didn't even understand, first of all, that there's two different ways to be on Medicare, and that it took her off of her Original Medicare, and that she was put on an HMO, and that HMO plan would require her to have a referral from her primary care physician. Also, what she told me today is that call center agent never even discussed with her health condition and didn't ask who her primary was. And this woman has kidney disease. So it is alarming what goes on out there. So please guard your Medicare number with your life, like it's your Social Security number. Once you give that out to an agent over the phone, if they're in one of the big call centers, they will shift you. They'll put you on a plan where they're going to make money and do not care about you. Just as this J.D. Power research shows, and the confidence and credibility of the insurance company, you also need that when you're working with an insurance agent. That insurance agent can be over the phone. It's just, you need to be incredibly careful about who you're speaking with over the phone. Ask for their insurance license number. Ask who they're working for. Ask which insurance companies they represent. Ask all the questions. Advantage plans enrollment has been on the rise, as I've reported in other episodes, mainly due to the misleading Medicare Advantage commercials that had been airing nonstop and confusing the American public on Medicare. So the J.D. Power study indicates that trust and effective conflict resolution play a pivotal role in member satisfaction. When we look at Medicare Advantage plans alongside the original Medicare, we find that certain Medicare Advantage plans may present shortcomings in these critical areas. This aligns with the study's discovery that trust and problem resolution are the most influential factors associated with member retention on the Medicare Advantage plans. The study further delves into the aspect of care accessibility and digital integration. The finding that only 31% of Medicare Advantage plan members say that their plan made it easy for them to find care underscores a big concern. Similarly, with just 34% using two or more of the digital tools offered by their Medicare Advantage plan, we see a potential gap between expectations and reality in comparison to what we expect from traditional or original Medicare. Drawing from this wealth of insights provided by the 2023 Medicare Advantage study, we're able to construct a comprehensive assessment. This study sheds light on the fact that while overall customer satisfaction with Medicare Advantage plans falls within the good to great range, specific aspects like care accessibility and digital tool utilization might leave room for improvement. Armed with these insightful findings, you'll be much better equipped to make decisions that align with your own individual healthcare needs, budget, and preferences. The J.D. Power study emphasizes the importance of informed choices by highlighting that consumer-facing attributes like trust and customer ratings significantly impact satisfaction and loyalty to their Medicare Advantage plans. As an agent, I find that those on Medicare Advantage tend to switch every single year, whereas those on a Medigap plan keep it for their entire lifetime. Thank you for your time today engaging in this study with us. I hope I've provided you with valuable insights, and I invite you to show your support, get this information out there by sharing this video. Be sure to subscribe and activate your notifications. Until next time, stay informed and empowered to make your best Medicare choices. And Medicare open enrollment is coming up, starts October 15th through December 7th. Until our next episode, be well.